Thank you, Shirley. Thank you for that heartwarming blessing and for starting us off in a good way. For anyone else that is joining us, welcome to our training on Indigenous resiliency and thriving prevention programs. Today is our third session in this workshop series, and we will be talking about building partnerships. My name is Cindy Sego Umo, and I work with the Native Center for Behavioral Health, and I'm the program coordinator for the National American Indian Alaska Native PTTC. Next slide, please. And so just a brief introduction to our PTTC network. We are part of the Prevention Technology Transfer Center network. We have 10 regional centers all over the nation. Our national coordinating office is in Kansas City. We also have our sister PTTC, the National Hispanic and Latino PTTC, and we are funded by SAMHSA. And so even though this program and webinar and our center is funded by SAMHSA, the content of this training is the creation of the presenters, and the opinions expressed do not necessarily reflect the views or policies of SAMHSA, HHS, or the National American Indian Alaska Native PTTC. Next, please.
Oops, sorry.
And so after this webinar, we will be sending out the presentation slides and recording. The recording will also be on our YouTube page. You will have information on how to request and receive CEUs for attending this session. And we'll also have a link to our evaluation survey in the chat box by the end of the session, and also in the follow-up email for this training. Next, please. And so even though we are gathered here virtually, we would like to take the time to acknowledge the land and pay respect to Indigenous nations whose homelands were forcibly taken over and inhabited. Please take time to read through this land acknowledgement. I'll just give a minute or so. Thank you. And this land acknowledgement was written by 3 members of our team, Ella and Kelly Driscoll, who are sisters, and Sean Bear, co-director, members of Nisquaquie and Winnebago Nations. Hi, Christine. We lost the slide there. Okay, I think we lost Christine for a second. She'll be back. In the meantime, I'll upload the slides from my end. Oops. My screen is having issues too. I'm not sure if you're seeing the right screen. Please, are you able to see my screen?
Yes.
Okay. Okay, thank you. And so we unfortunately lost our speaker, Justine. From the
Shirley, I think I'm back.
Okay.
She's back.
Great.
Yeah, sorry, I got kicked off and I think I'm back. Am I?
Yes.
Yeah, you are.
Yeah, no, okay, so let me share my screen. Sorry about that.
That's okay.
Now, are we good?
Yep.
Yes, we're good.
Okay, so if it happens again, I will just keep, I'll talk and you can do the slides, Shirley.
Okay, that's fine.
Sorry about that.
I'm handing over to Justine now to introduce herself and take us with our session. Welcome, Justine.
Thanks. Thank you very much. And thank you, Shirley, for that wonderful, wonderful prayer and blessing. And Cindy, for getting us started and managing with everything when I got kicked off. Let's hope that that doesn't happen again. So anyway, let me sort of gather my energy now that I'm back on, and we'll get settled into this third session on partnership development. I want to start, however, taking us back just a little bit to what we're talking about in general. And in general, some of you have been with us all three of these sessions, but in general, what we're talking about is building resilient, sustainable organizations. There's many ways to do that. And what we're talking about is coming at it through sustainability. And as we look at that, today we're going to be looking at developing partnerships. We want to look at the identifying potential partners. Last month, we talked about looking at the internal support that we have, because it's so important to have support internally from our own tribe, from our own community. And today we're going to talk about how do you reach out to develop partners. Really, you can think about them external partners, external to your tribe, external to your particular program. So we want to look at that. We want to identify some of the barriers to developing those partnerships, as well as come up with a plan for that. Grounding ourselves again in terms of what do we mean by sustainability? We're not necessarily sustaining the program that we're currently involved with. What we're wanting to sustain and what we want to continue are those actions, those activities, those parts of our program that meet the needs of the people served by our project. We want to do that with resilience and kind of seamlessly. It's not we're not trying to sustain the actual project or the organization that we're working with, but we are wanting to continue to meet the needs of those clients that we're currently meeting. So if you've been with us from the beginning, this is not new, but I want to just remind us, we come at this from a framework of sustainability, which talks about 4 pillars. Think of it as the four legs of a table. You know, you sit at a table and one leg's a little short and you're eating and your glass falls off the table. We want each of these legs to be strong, and they're always founded and built upon that strong evidence-based program. We've talked a lot about building our case for sustainability. Last time we talked about the internal support pillar. This time, as I said, we're going to be looking at partnerships. So let's begin. And as we begin, we always come back to that strong foundation that we have because of the program that we're working with. We look at the specific needs that our program is addressing, how we're meeting those needs, and we're looking at our track record. With that, we then begin to look externally for building partners. I know we've talked about different kinds of partnerships before, but I want to for sure have us remember the partnerships that are available. Often, particularly in the nonprofit world, we often think about partnerships as really just an area where we get resources. I'm not in any way saying it's not important to have those areas. It's very important to have partners that will give us resources and from whom we can share resources. That's absolutely accurate. However, there are partners that we have that are actually collaborators, and we need to think of them and build that partnership the same way we do partners that are funding us. So collaborators are those organizations, are those individuals that walk side by side with us. They're perhaps meeting the same need as we are. They're perhaps working with the same organization, or not the same organization, but they're focused on the same clients as we are. If we're into substance use disorder, we're looking at others that are working with substance use disorder and how they're doing it. They are collaborating with us to meet the needs of those in our community. that it's a very important partnership to look at and to build and to enhance, because as you collaborate together, you can then sort out who needs to do what, so that you're in no way replicating services, but you really are building upon one another's services. That can be difficult, and we'll talk about that, but that can be difficult because we have a tendency to get so siloed in terms of our own work, and so do others, that it's hard to see collaboration. But collaborating, I mean, you all know this better than anybody in the world. Collaborating is the only way that we will get things done. There are also partners who advocate for us. We all need cheerleaders. Think about this group in terms of sphere of influence, if you will. You all know that you and your organization have certain people that you come in contact with, that you talk with, that you work with. So do other people. So for advocates, you want to look for people who are able to tell your story in areas that you can't quite necessarily reach. So you might look at the Chamber of Commerce, for example, in the town where you are. Do they know about you? There are a whole area there that can advocate for the kind of work you do in groups and in audiences that you don't really have access to. Are your county supervisors or the Board of Education in terms of your town? Who are the people in those different areas or in those different organizations that can and will be advocates for you, because they're concerned about what you're doing as well. And then, of course, there's the whole area of partnership where there is a sharing of resources. And think about this widely. It's absolutely in terms of money. We all need money, and I'm not denying that. There's also perhaps other areas in which they can provide you resources, like they might have rooms. Thankfully, and surely in her prayer this morning and in her blessing, talked about those that are still suffering from COVID. Thankfully, across the country, it does seem like we're safely opening up a bit. So you may be looking for rooms in which to have a meeting that maybe some other organization can offer you. You may be looking for trainers that you can use. You may be looking for just notice in a notice that goes out, or a newsletter that an organization has, that you can be a part of that. That's another resource that you can have. And then, of course, there's money. So as we go through, and if you're close to your computer and can add to your chat, do add who are some of your current partners. Add in that we can begin to think about that, and that we can share who those partners are, internal and external at this point. And think about from collaborators to advocates to those that actually provide you resources. Oh, the local school districts, absolutely. Schools are great partners, particularly now that we're having in-school sessions again, right? I mean, it was good to be on Zoom, and now that we're meeting in classroom again, it's good to have partners in those schools. Now, community food banks, of course, that's a great one. Yeah, housing sites, co-op, early childhood, very nice. These are great. Oh, behavioral health, police department, clinics, absolutely, absolutely. These are great ideas, and I hope they're stimulating others of you to think about, wow, where could I possibly look for a partnership that maybe I haven't looked at so far? So what we want to do now is I want to just walk you through, as you're thinking about strengthening your partnerships and or finding new ones, I'd like to walk you through a process which organizations have found helpful as they have thought about developing and or enhancing different partnerships. Somebody just put the cooperative extension program. That's a great one, because they get out they touch so many people that you're going to want to touch as well. So as you're thinking about developing partnerships, think about, you really want to plan, and you're going to want to do some research with those that you currently have, as well as if you're thinking about new ones. Think about, first of all, a specific need that you want to address. And this can be as simple as you would like a letter of recommendation for a grant that you're writing. You'd like a letter of support for a grant that you're writing. You'd like more data in terms of what's happening in your county. You would like, I suggested some, you might like a room for training. You might like to be in somebody's newsletter. You might like to be a speaker at somebody's event. There are all sorts, in terms of getting the word out. You might also want to open up a whole new avenue of where your services can have an impact. So think about specific need. Money, absolutely, and beyond money. Where can you reach out? Who can you reach out to? And then why is this important? Well, some of it's obvious, right? You need a support letter for a grant because you're really needing this grant to keep your program going. And a support letter from like the County Health and Human Services Office would be of great value if you're going for a grant with SAMHSA. If you're looking for data, one of the reasons that you want to use the data, want the data, is so that you can use it to learn how your program is doing in relation to how other programs are doing, or also so that you can support what it is that you're doing within the larger context and what options might work. The other thing to keep in mind is when you have a specific ask, the organization or the group that you're seeking out and that you're going to have a conversation with may have a whole different idea of how they could be able to help you. So don't get honed in on there's one way to meet this need. Think about it in terms of you're opening this up with curiosity and you're saying as much as you can about what it is that you would like, the need that you need to address. For example, you want to be in more classrooms, or you want to be in classrooms at a time with a prevention program at a time when the teacher is there as well. Whatever your need is, think about it both specifically and broadly, so that then you open up the conversation with the potential partner. So you're doing the research based on what you need and where you might go. Then you think broadly about where and who might meet that need. And I've just put down a few, but I'm sure, whoops, sorry about that. But I'm sure those of you on the call have other ideas. You've already put them out, the cooperative extension programs. That would be an education or part of the training community. Somebody said the Tranquility Ranch Equine Assisted Therapy. That might be one of the agencies that's providing assistance that could be of assistance to you. There, as we've mentioned, the state and county service agencies, like your county HHS, your state HHS, the Children and Family Services, juvenile justice, the police department, those kinds of things, local national foundations. Be sure and think about foundations, particularly in relation to funding. Minnesota has had luck with Robert Wood Foundation, the McKnight Foundation, the George Kaiser Foundation. And people in your organization know the foundations that are active in your area and what they're currently looking at. And there is now, foundations are moving toward equity. As I was looking on the web this last week, trying to look at those foundations that are providing assistance here. So many of them are looking at equity in health, equity in services, equity across the board. They're looking at the data in terms of how Indigenous folks and Native Americans are high on the charts with substance use disorder and what that means. So you follow along with those. They're wanting to help. They don't know that you're out there unless you ask. So be sure and go for that. Another program to consider is AmeriCorps. Maybe some of you already work with AmeriCorps. AmeriCorps is not going to provide money, but they will provide human resources. That would be an organization that you could go to and get a grant from to support human resources in your program. Let's say that you have a prevention program that is working in the schools and you need more on the ground presenters, on the ground coaches, on the ground educators, if you will. AmeriCorps is a great place to look for that because you'll find sometimes young people, sometimes middle-aged people who have the time and the interest to work in those areas. Another one to remember is Medicare, Medicaid, and fee for service. You can think about it as fee for service and then look at Medicare, Medicaid, and some of you have already been successful in this in terms of getting those organizations to support fee for your services, which then, of course, allows for the sustainability as well as the growth. And I know you've read and you're keeping up with the pharmaceutical settlements. They're down the road, I understand that, and they're huge and they're national and they're all of that, but keep your eye on it. There's one that's just under negotiation right now. I think it's been determined and now they're determining how they're going to get that money out, but it's something like $517 million over 3 years. Not a lot when you look across the country, but remember that it's there, and who knows whether you get any money from that, but it's a way to keep the energy going. So you identify your needs, then you look big and look out there to see, okay, who might meet that need? And again, look with curiosity and look with a wide open stance for that. Then you want to get to researching potential partners. And this is when you ask yourself, what is their general focus and interest? Like if you're going, and many of you, this is a no-brainer for many of you because you've been working in this area, right? The County Health and Human Service Office is absolutely committed to healthy, safe, vibrant community where everyone has access to health. It's the same thing as you're looking for, right? There's a match there. How might they support your sustainability efforts? What might you ask them to do? This is where you look on their web, you look at what they're doing, you look to the people that you know. Always remember the next one. How are they going to benefit from partnering with you? Remember, this is a partnership. So it needs to be a win-win. How are they going to benefit from partnering with you? One of the things they'll learn is they'll learn about your program. They'll learn about the data that you have. They'll learn about your success. You can also teach them much more about how to work with people in your community if they don't know that, and if that's one of the things they're wanting to open up. It's a win-win. And then what message would resonate? And here again, remember, whoever you go to, the message might be different, totally different talking to the County Health and Human Services Office than it is to talk to a foundation, perhaps, or to talk to a businessman. You have the data, you know about your program, and you by doing your research, you know what they're looking for and how to frame your message in a way that they can help you and fulfill what they want to fulfill as well. So those are the steps. What is it that you need? Who might be able to provide that, looking broadly? And then as you sort of hone in on somebody, looking at what is it? Who are they? And where's the win-win? And where is it that the rubber meets the road? Where can we meet together to move down the road, if you will? Now, one of the things that we want to look at is what are the barriers to developing partnerships? And I'm sure you all have faced these and you continue to face them each day, but we want to bring them up so that then we can begin to think about, okay, what are some of the things we can do to counteract those barriers? One for sure is racism and bias. I know there's just no way to get around this. So often agencies, foundations, and organizations hold middle-class white standards. And there's the systemic racism, and then there's also the racist, biased ideas that are within the people that you're trying to greet and that you're trying to meet and that you're trying to see head on. Knowing that it's there, and I'm sure that you all know that it's there in ways that I don't, but it's good, particularly as you're thinking about how it is that you're going to frame your message, that you think about how it is that you're going to address this, counteract it, meet it head on, whatever it is you're going to do. The other one, I mean, yes, and I know that you'll talk more about this when you get in your groups. So the other one that happens so often is that people are just too busy. And particularly now, I think that's true. We're just coming out of a pandemic. We're also in a world that is filled with uncertainty, and people everywhere are unsure about what's going on and have their own worlds in front of them. And one of the ways in which, particularly when we're in a fearful situation, one of the ways in which we control that fear is that we hone in on our own silo and we stay busy within our own silo. And I know it's true. We are all busy. People are wondering if they're going to work in the office, if they're going to work at home, if they're still going to have work. We're losing staff as we go along. It's a very uncertain time. So in that time, it's very easy for people to just become apathetic. One of the pieces of armor that so many people put on is apathy. I can't take care of it all, so I can't take care of anything. And if it's out of sight, if it's out of mind, I've got enough problems facing me in front of my own face. Thank you very much. I don't have time. I don't have the energy, and I can't worry about what is going on there. So you all will have others, I know, that you'll be able to talk about and that you'll help one another with. But those are just a few that we came up with as we were talking about this session. Doesn't do to point out the barriers without also saying, how can we address these blocks? One of the best ways to address any of these blocks is to keep your and your staff energy up and to keep yourselves, and to keep yourselves with your passion. I don't know if you were with us the first session when we did the exercise, or we talked about what is it that we're most proud of in terms of the work that we're doing and the stories that we have to tell about that. Never underestimate the stories and never underestimate your passion and your persistence. That speaks more to people and to others through their busyness, through their apathy, than probably anything else. Then besides that, there is the information that you have about the issue itself and the importance of doing something right now, as well as the data that you have about what you're doing, the success that you're having, and the difference that you're making, the impact that you're having with the program that you have. When you come, regardless of, as I said earlier, you want to frame your pitch, if you will, or your conversation to the audience that you're approaching. And remember, underneath all of that, these elements, the passion, the persistence, the information that you have about the issue, the facts about your success, and the data that you have. So that kind of outlines what it is that we think about as we are either enhancing current partnerships or wanting to build new ones. So now you're going to have a chance to, you'll be working in groups of 4, and that's going to happen in just a few minutes. But let me make sure that you have everything you need as you go into these groups. We did just send out the link for this handout. Use it if that's helpful. But what it does is help you go through what you're seeking. There's some suggestions there, but they may be totally different than what it is that you're seeking. What are the key audiences that could support this or fill this need? Then when you get a key audience, what are your mutual interests? How will supporting you meet one of their needs or meet their needs? Again, this is the win-win. Be sure and look at that. And then what approach will work best? So these are the kinds of things to look at as you're in your small groups. This is a chance for you all to use one another as the resources that you are. You have partnerships already. You can share your needs, you can share what worked, and you can share what hasn't worked, and really support one another as you think about how you could best either enhance your current partnerships and or reach out to new partners in the work that you're doing. Are there any questions? And you're going to have a good long time in here. You'll have about 25, 30 minutes. So you're going to be in groups of 4. We've heard from the data that from your evaluation data that you've turned in on these sessions that you really appreciate the chance to work together. So please enjoy this time together. And please remember that there are 4 of you working on this. You'll have about 30 minutes. Keep your stuff brief. Get down to the point and away you go. I hope you have a wonderful time and we'll see you at the end of your time.
All right, so I'm going to assign everyone into groups. I see some folks. Okay.
I think looks like everybody's back.
Yep.
Great. Well, I'm going to stop sharing my screen. We want to take a few minutes just to share with one another. I know these groups were active and lots of information and good things were shared with one another. So we want to take just a few minutes to share with one another. So if you, and we want to think about, what did you learn during this? Did you learn about new partners or new approaches, something that you haven't tried before? Did you think about win-win in a different way? And just kind of what happened in those groups that we might just take a few minutes to share with everybody. If you have something to say, you can raise your hand or put it in the chat. Or just unmute yourself.
Well, good morning. This is Sean Milanovich.
Good morning, Sean.
I'm down in Southern California, quite a ways from a lot of you, but nice and sunny here. But you know what we were sharing in our group that, we all reach out to our communities and with a lot of social needs, trying to working towards the wellness of our community. And Melanie, she was just saying that, because we were talking about the missing, murdered Indigenous women and relatives. We're trying to build programs for that right now.
Oh, wow.
On May 5th, coming up this year. And, but she said, well, why don't you work with the youth? Talk to the youth about it. And the youth are really connected. And that, I think that's a wonderful idea. And the youth are one of our primary assets for our tribal people. So to work with them and to ask them, what they think, and also we can disseminate the information to them, and then they can share it amongst their groups, their peers. And I just think that we could do so much more by doing that. And I know a lot of different tribes and groups, they incorporate the youth, and then there's a lot that don't. But I know with my group, in Agua Caliente, we haven't spoken about that before. And so I think this is great. And so, our partnerships, it could just be within our own system, and we need to look at that a lot more closely.
Absolutely. And that's a really good point, Sean, and that group, in terms of looking at not necessarily a group or an organization, but are there certain age groups, for lack of a better term, that we're missing as we're talking about all of this? And unfortunately, it is easy to miss the youth. And to bring them up. Somebody said to me the other day, if you're in the room, you're a leader. So often when we look at youth or at anybody, we say, well, they haven't had a chance to really develop the leadership. But the truth is, we're all leaders once we're in the room. Nice. Thanks, Sean, for sharing that. Anybody else want to share something?
Yes, I'd like to add to that. My name is Jeffrey Couchy. I'm up here in Anchorage, Alaska. And Sean, yep, and Justine, getting the information is from the youth, and working with the youth is very important for a lot of communities. And I tell you that in my previous experience and assessing a organization, assessing a village, or assessing a town, is to meet with the tribal leaders and the city government leaders, the actual leaders on where can I get this assessment done at. So what we did was, we did send information out on questions about the community and about the activities. But I'll tell you, when we got the assessment from the leadership within the communities and organizations, we did meet with two groups of youth. One group was very vocal. I mean, they just could not stop talking, which was really great. The second group was an older group, and the assessment that we got from the youth were very simple and very direct, and it was very helpful, aside from getting the assessment from the community leadership. So great job in bringing that up, Sean.
Yeah, thanks, Jeffrey. And also talking about how you might do that, like to really set up a group where you're really talking to them, and as you and that you want their information. It's not just that you're being nice, but you talked about, Jeffrey, you talked about the difference with the two groups, and that does bring to mind what Jeanette put in the chat, and that's, yes, how boarding schools have taught the Indigenous communities to be submissive. And with that, we need to help people by reaching out with the questions so that they learn that their answers make a difference.
This is David Shorey. I am the East County Program Manager for the Institute for Public Strategies. We're focused in San Diego County. One of the things that we really focus in on, and I think it was echoed in our group, is the aspect of connection, whether it be connection to Indigenous practices and stories and elders, or connection to the community in which folks live. And knowing that, when you focus on prevention, whether it be drug and alcohol harm or suicide or other, that a lot of folks really, there's an issue of isolation and not connection. And we also talked about ACEs, adverse childhood experiences, and toxic stress, and historical trauma, and the overlays that they have to the work that we do, and really understanding that you can try to focus in on individual behavior, but not understanding if you don't focus in on the community conditions, then you're kind of putting a Band-Aid on a much larger wound. And so being aware of that, raising those issues up, having those discussions about how folks are connected to their communities is vitally important, because out of that you build connection, you build kind of that web, and you find that people don't feel as isolated or alone, and can engage together to address it from a community-based perspective.
Thanks, David. That's great. And that does bring up the one of the underlying supports of resilience, which is all about relationship, and relationship is about connection. And I know that you've all talked about that within your groups in terms of how do we start? We start through the connection. Who do we know? How can we, whether it's youth or whether it's an organization or whether it's a foundation, it starts there, and it's got to start with the connection. And I also realize, David, that you can't, and you all realize this, you can't just pull out one behavior. It's the context that you're all looking at to bring about real change. Well, and we're coming up to the end of our time. I know, Shirley, you had something that you wanted to offer with regard to direct billing.
Yes, thank you, Sean, Jeffrey, and David, for your awesome insights. And I actually took notes because I really like, the information that you shared. So just to supplement what Justine said about the Medicaid part, I worked with a grantee recently who went through that whole process of, and I'm sure some of you have that already, and if you do, fantastic, because it's permanent, sustainable income or resources, and it's the direct billing process. And then Justine talked about fee for service. That's another funding pool. But the tribes have a tribal encounter rate right now, from what I understand, it's about $519 per encounter. So it could be a substantial source of funding for tribes. You just got to work with Indian Health Services and then have an agreement with them to be able to do that. And then you also have to work with your state, the state that you're in, to make sure that the professionals that you're using to bill for, that they're licensed and credentialed under state law, except in Minnesota and I think Wisconsin and Michigan. In Minnesota, it's called UMACAD, and they license the tribes license their own people, and it's right in state law. They tack it on to that state law. So the state recognizes that. And so then the Medicaid pays for that. So that's an awesome source right there. One other thing, we're going to ask you a question in the GIPRA, and Cindy will send that out. And one of the questions that I would like to know is, would you like more information For example, do some of you want information on how to write a grant? Because I know not everybody has teams. Sometimes there may be one or two of you that are doing all the grant writing, and there's a lot to it. I took notes when I attended a webinar on grant writing, but my notes are designed for OVC grants. There's a whole ton of other grants available. But I think some of the concepts from my notes are really good. And then I think she'll add like data and anything else that you would like more information on. Because if you do, then we'll see about getting somebody to present on how to write a grant and then how to prepare for it. Because if you're prepared and you're organized, you can get it. And it's never a permanent, sustainable source, but right now there's funding for tribes, and I think now's the time to strike while the iron's hot.
That's exactly right.
One other thing, next webinar, we're going to be presenting on data collection. Mm-hmm. And right. So, yeah, a person that works for Yurok tribe, her and her group did a survey. They surveyed people in the community, and then also did focus groups for elders, and it's a public health survey. And the number one concern about health in their communities is substance use and mental health. Substance use and mental health are some of the top two concerns, and then how it affects the families that have loved ones that are living that lifestyle. So I'm really excited about having her come, and very well done, very organized, and then also how she does the analysis, because that's another key piece to having data, is being able to do that interpretation and that analysis, and then using it to help get further funding. That's invaluable in doing that. And then also, if you weave that into the evaluation piece, like when you do focus groups or surveys, those are really awesome evaluation pieces too. So, okay.
That's great. Thanks, Shirley. So yes, Shirley talked about the session that we're having on April 27th, where we're going to talk about data gathering and have the presentation from the Yurok tribal findings, which are absolutely fantastic. It will be a wonderful example for everybody in terms of what the questions were, how they went about it, and how they are using that data. Then the final session from this series will be on May 11th. And that will be looking at our fourth pillar, marketing and outreach, with bringing it all together in terms of how do we market and how do we reach out. So as Shirley's going to sing us out, oh wait, Shirley mentioned this as well. And Cindy's going to be sending either through GIPRA or through SurveyMonkey, just a survey to all of you that have been a part of this series. And as you're thinking about program sustainability and enhancing that, what are you working on now? What would you like help with? And as Shirley said, particularly, would you like help with grant writing? Are there other areas that you would like help with? And expect that coming soon so that we can respond to that. As we finish up and Shirley sings us out, if you would just in the chat think if you have something, what are you taking away from this session? And just enter one or two things in the chat. It's been wonderful to have you with us this morning. It's always good to just set aside some time and get together. So appreciate your time. Thanks, Shirley.
Oh, miigwech. Miigwech in my language means thank you. So miigwech to all of you that came and participated, and it looks like some of you dropped out. And that's okay. Yes, David says we have more in common than we have different. And that's so true. Totally. And I think the thing that most communities would like to see for their people is to have good health and to be happy and to want the best for each other. And I think that's another thing that they asked in the Yurok. It's actually spelled U-R-O-K. And there's a Yurok tribe from Northern California. I'm sure those of you in California have heard of them. They're a small tribe, but I've been working with them now for about 2 years, and they're so on the ball. And I'm just so blessed to have met them and to watch the things that they do. And they also use AmeriCorps volunteers or AmeriCorps people in their work. So, and the other thing that they asked about was, what are community strengths? And just like what one of the people said, is one of the strengths is coming together and helping each other when you all need help. And I saw that when COVID first started, how people helped the Navajo tribe and helped the Pueblos, some of those ones that were hit hard and fast in the beginning. And we had a group of women here in Minnesota that made masks for them and then mailed them off. And so I helped with that. And I was really blessed to help with that process, because the more we help each other, the more help comes to us. I believe in giving and taking both ways. So anyway, this song, I'm just gonna sing a couple of parts to it. I'm not gonna sing the whole thing. Way-ah-ya, ho, way-ah-ya, ho, ya, way away. Way-ah-ya, ho, way-ah-ya, ho, ya, way away. Yahweh away, Yahweh, Yahweh away. Yahweh away, Yahweh, Yahweh away. Manidu makwa ona bida kozit. Manidu makwa ambe jawe the missionan. Way-ah-ya, ho, way-ah-ya, ho, ya, way away. Way-ah-ya, ho, way-ah-ya, ho, ya, way away. Yahweh away, Yahweh, Yahweh away. Yahweh away, Yahweh, Yahweh away. Manidu makwa ona bida gozit. Manidu makwa ambe away the mission on. Woo! Woo! Okay, miigwech. See you next time.
Thank you, Shelley.
Thank you, Shirley, so much. Bye, everybody. See you next time. Thanks for joining us.